Primary start, yeah.
Thanks very much, Ríordáin, and thanks very much, Minister, for being here to discuss this matter. Minister, I'm quite sure you're aware of the ongoing issue relating to the emergency department in Beaumont Hospital. Over the last number of years, as an elected representative and a member of the Oireachtas, I've visited the A&E in Beaumont Hospital. I've met with staff there, and I've met with senior management on a number of occasions. And what senior management have told me in very stark terms is that the A&E is physically not fit for purpose. Now, there are other issues around the problems that the A&E has, there are staffing issues, and also that the demographic around Beaumont Hospital is of a particularly elderly nature. So it's not just the physical issue of the department, but that is part of the issue. And these are eminent people, these are experts in the field, they know their hospital well, they care for their patients extremely well. But anybody who has visited the A&E will know and will attest to the fact that the physical environment of the A&E is not up to standard. And if the senior management team in the hospital are saying that it's not safe and they can't stand over it, well then clearly something has to happen. Now, we're obviously now in a period where the Exchequer is in a healthier place, and the management themselves have put together a plan which they see, they have a vision of investment in the A&E that can bring it up to standard and provide a much better service for the local community and the wider Dublin and wider region. They've estimated at 45 million. The last government, in the guise of the then Minister for Public Expenditure and Reform, Brendan Howlin, and myself met with the senior management, and we were in a position to commit to working with the senior management of Beaumont Hospital to deliver this plan. So that investment would happen, that the A&E would be reconfigured and reconstructed to be a much better physical fit for the hospital. I've been running a local campaign, Minister, locally, where people have been engaging with this campaign who want to see this investment happen. So what I'm asking, Minister, is has the Minister for Health and your department committed to this €45 million plan? Have you met with senior management? Is it part of the estimate process? Is it something that is going to be delivered in the short to medium term? Because I think anybody who, as I say, has visited the A&E in Beaumont will realise that the situation there can continue. And while I didn't see anything in the estimates process and the budget announcements regarding Beaumont Hospital, I was eager to have this discussion today because before we head into the winter months, it's important for the staff in Beaumont and for the wider community to know that the government takes this issue seriously and wants to deliver better service for that hospital. Come out of the last couple.
Thank you. Senator Minister.
Thank you. I want to thank Senator Aodhán Ríordáin for raising this very, very important issue, and it's very appropriate because I'm just coming from a meeting this morning in Hawkins House, and I'll deal with that, the response to the Beaumont Hospital issue later on in my contribution. As you know, first of all, I want to thank the Senator for raising this, this very, very important and bringing it before the House. 2016 has been an exceptionally busy year in our acute hospitals. The increase in hospital activity can be seen across the board, in particular in our emergency departments, and to date this year the HSE has reported an average increase of around 5% in inpatient attendances at our emergency departments.
Forgive me, Minister. I think we've been handed the wrong response. Can I get the usher?
Oh yeah, no problem. Yeah,
I think we've been given. Am I right, Senator? You got? Yeah. Sorry about this, Minister. Late.
An average increase of around 5% in our inpatient attendances at our emergency departments. This increased demand has been driven in part by the demographics and an ageing population profile. In this context, it is worth noting that the 2016 census identified an 8% growth since 2011 in the population of Fingal, which is predominantly served by Beaumont Hospital. Being cognisant of the current demands on the Beaumont Emergency Department and projected population growth in that area, the development of a new emergency department at Beaumont has been identified as a commitment of the programme for the partnership government. It is also noteworthy that the programme for a partnership government also commits to proceeding to the design and planning stage for a dedicated cystic fibrosis unit at Beaumont Hospital for inclusion in the 2017 Capital Plan review. The HSC Cystic Fibrosis Clinic programme is currently developing a CF model of care which will be important in ensuring the unit proposed for the Beaumont Hospital will meet the needs of patients and the health service. It is my understanding that both of these projects are also a priority for Beaumont Hospital and the RCSI Hospital Group, of which it is a part. As such, Beaumont Hospital is currently in the process of finalising business cases for these new developments. The business cases will be then reviewed by the HSE's Capital and Property Steering Group, which approves projects for inclusion in its multi-annual capital plans, in line with the Department of Public Expenditure and Reform guidelines. As part of this process, funding provision will be made available for the planning and design phases of these proposed new developments in preparation for the Capital Plan review in 2017. I would also like to mention that as part of the recently published Winter Initiative 2016-2017, Beaumont Hospital will be provided with the resources to open 10 additional beds to increase capacity in order to support its emergency department during the crucial winter period to meet the expected surge in volume. Furthermore, under this initiative, funding is also being provided to expand community intervention teams, additional home care packages and transitional care beds in North Dublin, which will support Beaumont through the winter months. This measure is part of a much larger package of 40 million of additional funding to the HSE aimed at managing winter pressures on our health system by striking a balance between hospital-advising measures, supporting patient flow through acute hospitals and increasing the availability of social care services. And finally, of course, I want to assure the Senator that Beaumont Hospital is a very, very important hospital. I do accept the point that we need capital investment in our A&E services. I do accept your point, Senator, that we have an issue with the very highly ageing population in our local community, and the physical environment of the A&E is not up to standard, and that's something that will be pushed along over the next couple of weeks as well. Thank you.
Thank you, Minister. Senator, you might like a supplementary.
Thanks to the Minister for the reply. I just want to pick through it for a second. Phrases such as "it is my understanding." I sometimes get a little bit worried when people say "it's my understanding." I would hope for something a bit stronger than that. Beaumont Hospital currently in the process of finalising business cases for these new developments. Well, Minister, it's my understanding that Beaumont Hospital has completed its business case for the A&E because it was handed to me almost a year ago. And it details the 45 million that they feel will be required. Business cases will then be reviewed by the HSE's Capital and Property Steering Group, which approves projects for inclusion in the multi-annual capital plan in line with the Department of Public Expenditure Reform guidelines. So once the business case, which has already been finalised in my view, but your reply is saying that it will then be reviewed by the Capital and Property Steering Group. And then, as part of this process, funding provision will be made available for the planning and design phases of the proposed new developments in preparation for the capital plan review in 2017. I suppose, Minister, what we're really hoping to get from you and the Senior Minister is a commitment that the capital plan, as already outlined by the senior management in Beaumont Hospital, which I have a copy of, is being taken seriously and is going to be delivered. So what seems to be in your reply is a suggestion that their business plan hasn't been finalised when it has been. And what I also seem to get from your reply is that it'll be it will then be reviewed. I think the community around in your own constituency as well, Minister, would be hoping for something a little bit stronger as to when they can hope. I totally understand that there's other issues as well in terms of staffing, and I totally accept that, and the demographics around the hospital, which are particular to Beaumont and that wider area. But in terms of this plan, this business case, which has already been made, I'm just worried a little bit about timelines and about the commitment that you can give in terms of delivery of the physical infrastructure that the hospital says it needs, because currently they can't stand over. They can't stand over the service that they provide, and that's extremely worrying, and I'm sure you agree.
Thank you.
Thank Senator Ríordáin for his response. And of course, I'm always concerned myself when I see phrases like "it is my understanding." But can I assure you that I will give you a commitment here today that we'll have movement on this particular issue and also timelines. And just to kind of give you an up-to-date situation in relation to the business plan, I've just discovered in recent days, for example, that in relation to the last business plan that you mentioned there, that they needed a more comprehensive business case was required for the process in order to comply with the Department of Public Expenditure guidelines as set out in the Public Spending Code. That's the first thing. Now, I also requested my adviser to meet the Secretary-General of the Department of Health in order to set out a work plan to accelerate this process. And they met the same day as the Beaumont Hospital submission was received by the Department of Health. And this work plan involves the Department of Health, the HSE and Beaumont Hospital, prioritising and clarifying the timeframes for the submission and appraisal of a full business case for approval of the project team establishment and design team appointment. This work is a priority. I raised this matter this morning, as I said, with the Department of Health at the MINMAC meeting. That's the Ministerial Management Advisory Committee. I've also contacted the CEO of Beaumont Hospital, outlining the next immediate steps that will be taken, that this project is a major priority and has all of our full support. I have secured, and here's the issue, the funding for the planning and design phases in preparation for the capital plan review in 2017, and I've also contacted Mr. Minister Donoghue and Department of Public Expenditure, both verbally and in writing, seeking funding priority for this project in 2017. I think in the region of the planning design figures are in the region of 3.6 million, and then, as you said, the capital plan goes up into the 20s or higher than that. But basically that's where we are. But I can give you a commitment that I will not accept any kind of windy statements from any sections, that I will be demanding that we have moved into this, because it is a local hospital. It is a very important hospital. We have a wonderful staff up there, and we need commitments, and I'm giving you a commitment here this morning, but also we need timelines, and we need to get on and do the job.
Thank you very much, Minister.